Suctioning is a process of removing secretions or mucus from the tracheostomy tube. This will keep the tube open and allow your child to breathe more easily. Your child should only be suctioned as needed, since frequent suctioning can cause more mucus production. Signs that your child needs to be suctioned include gurgling sound from the trach tube or bubbling of mucus at the trach tube, secretions coming from the trach tube, increased coughing, rattling of the chest or noisy breathing not cleared with coughing, increased oxygen needs, difficulty breathing such as nasal flaring, retractions, or pulling of the muscles between the ribs or beneath the ribs, or breathing faster than usual. Items needed include a charged suction machine, appropriate size suction catheter. This can be a single-use catheter or inline suction catheter if your child is on a ventilator. Clean gloves, distilled water to rinse the suction catheter, saline as needed, and ambu bag. Prior to suctioning, you should know the proper suction depth. This can be determined by placing a clean or unused suction catheter into a spare trach tube that is the same size that is in your child, until the first opening of the side of the suction catheter is visible beyond the end of the trach tube. This length should be remeasured if your child's trach tube size changes. Suctioning too deeply can cause bleeding and trauma to the airway. Not suctioning to the end of the trach tube can cause incomplete clearing of mucus from the trach tube, increasing the risk for mucus plugging or complete obstruction of the trach tube with mucus. After you determine the proper suction depth, you will want to document this by number, which is the centimeter depth. While the inline suction catheters do have colored markings, it is best to know the centimeter depth or numbers, as different brands of the catheters may use different colors for their markings. We will first demonstrate using a single-use suction catheter. First, wash your hands if you have time to do so. Parents should clean their hands. Healthcare workers should wear gloves. This is not a sterile technique in the home setting. Have a small container of distilled or sterile water near you for rinsing the suction catheter as needed. Open the suction catheter if using a new one. Connect the suction catheter to the suction machine. Turn on the suction machine. Using a pre-measured suction technique, insert the catheter into the trach tube. Cover the thumb hole and apply suction upon entering the trach tube, as well as when pulling out, using a twirling motion between thumb and finger. The suction catheter should not be in the trach tube for more than 5 seconds. You can rinse secretions out of the catheter using distilled water at home. Use a few drops of saline in the trach tube before suctioning if secretions are thick. Repeat as needed to clear all secretions. When you are finished, you can dispose of the suction catheter. Some people do reuse the suction catheter multiple times at home, as you will not have an unending supply. You can rinse the catheter using distilled water and replace it in its sheath. You can reuse it several times as long as you are keeping the inside of the suction catheter clean. You may want to wipe the outside with an alcohol wipe. You can also place used catheters into a container for cleaning at the end of the day. You will wash the catheters in warm soapy water and rinse them using a diluted vinegar solution for cleaning. When using an inline suction catheter, this catheter can be kept attached to the trach tube and in line with the ventilator. It can be removed if your child is up and out of bed. Wash your hands if you have time to do so. Parents should clean their hands. Healthcare workers should wear clean gloves. Again, this is not a sterile technique in the home setting. Attach the suction catheter to your suction machine. Attach the other end to the trach tube if not already attached. Unlock the thumb control valve by turning it clockwise. Turn on the suction machine. Using a pre-measured suction technique, Advance the suction catheter with a pinch and push method until the pre-measured number is visible through the lavage port. Apply suction and wait for approximately 2 seconds before slowly withdrawing the suction catheter to the starting position. You can clear the secretions out of the suction catheter by attaching a saline vial at the lavage port of the suction catheter. Repeat as necessary to clear all secretions from the trach tube. It is important to assess the secretions you are suctioning from the trach tube. You will get to know what normal or usual secretions look like for your child. If you know any changes, such as a change in color, odor, amount, increased or decreased, or thickness, this may indicate a lack of humidification or need for more fluids or possible infection. With any concerns, please contact your child's provider.